Before coming onto the program, I was working in a warehouse, and as I read it, it says that you'll be trained on the job for a couple of months, and so I quickly applied for it, and I was worried that I didn't have experience and I might struggle.
We utilise the programme as a training facility to be able to encourage the individual who comes through the programme to actually learn the skills to use as a clinical support worker that can be utilised everywhere throughout the trust and in other trusts as well.
It allows us to take on people that we know that as soon as they're signed onto our books, they know exactly what they need to do and how to do it.
You sign up with the NHS professionals, and then they take you and train you for a 1-week training, but it's very intensive. And then you come on the ward, and a fully qualified nurse will be waiting for you. You see what she's doing, and so you learn. And it's not like a one-day thing, it's a continuous process.
If you do the NHSP training program, you get qualifications, you get the care certificate, you get the experience while still working and being paid.
They are employed through NHSP, but they work as part of my team.
The work of our auxiliary nurses, so has lots to do with basic personal care, so helping them with the daily needs such as washing, dressing, eating. There's also things like checking patients' observations, emptying catheters, measuring catheters, being there for the patients.
You tend to build the confidence, and you are doing things accurately as your mentor is doing, and it's really rewarding.
If I've worked with you a couple of times and actually I can see that you can tell me the reasons why you're doing things, you understand the rationale for doing things, and actually you're doing the appropriate procedure carefully, then we would be happy to say that you're able to do that, competent to do that skill and allow him to do that by himself in the future.
I had a lot of experience as learning at the same time working. It was like, that is where I wanted to be. And so it made the program and the studying much more easier for me.
It was really good because it was kind of sense of security. So while being a trainee, I still had a stable job. I had a guaranteed amount of hours per week. So it was more like working as a permanent member of staff than a bank.
There's a certain time period that they have to work in regards to hours, and that's generally fits within a 6-month period. It's very much a case of actually for that 6 months, these individuals are part of our team. They're not extra on top of what we've already got.
Probably for the last 12, 18 months, every member of staff that we've had, we've taken them on and made them substantive because we've grown them ourselves, we've moulded them, they've joined us, they're part of the team.
So once you finish, you have to write the final exams, and then when you pass the exams, you get a certificate. So it means that you are confident enough to work on your own.
We gain in the fact that we know what their competency is. So a member of staff will come to us, we know exactly what they can and can't do because we've trained them.
It's a fantastic program that will explores a lot of avenue in your learning outcomes, which will help you whilst in uni and also on the practice as well.
It's a really good opportunity. I think it provides a really good way into the NHS.
It is something that actually without our auxiliary nurses that work in the hospital would grind to a halt. So having these individuals coming to work for us is a godsend, it really is.